Hello everyone, I am Dr. Shagufta working at Health and Hijama Clinic, Banaswadi, Bangalore. Thanks for watching my previous videos on high blood pressure and fatty liver and other videos. I hope they have been informative and helpful. My next video is going to be on hair related problems, how to grow beautiful hair and how to control hair damage and hair fall. Coming to my today's video, it's about the Dangal girl Suhani, who has played the role of child Babita Bhogat in Aamir Khan's movie Dangal, who dies of a rare inflammatory disease called Dermatomyositis. I'm truly sorry to hear about the loss of this young talent who was just 19 years old. In today's video, I'd like to discuss about the medical issue which has led to the death of this beautiful young talented actor. I'm sure she had a lot of dreams and plans about her future to have a good career in acting or journalism, which she was studying. But unfortunately, dermatomyositis has no cure and complications can even lead to death. Dermatomyositis, what is this? What are the causes, symptoms, management and treatment options? Watch the complete video till the end to know it in detail. It's important to raise awareness about dermatomyositis and other autoimmune diseases to facilitate early diagnosis and intervention. Dermatomyositis is a rare autoimmune disease that affects both the skin and muscles. In this condition, the immune system mistakenly attacks your body's own blood vessels throughout, leading to inflammation and damage. The hallmark symptoms include skin rashes, muscle weakness, and inflammation. It's different from other muscle diseases because it also causes skin problems. Dermatomyositis is the term used to describe both muscles and skin symptoms. It can occur at any age, but it most often affects adults ages 50 to 70. Women are twice as likely as men to be diagnosed with this disease. Some people with the disease also have a connective tissue disorder such as lupus or rheumatoid arthritis. The exact cause is not known, but possible causes include: 1 is the abnormal genes that you're born with, 2 is the cancer, especially in older people, 3 is the autoimmune disease, a type of illness that causes the body's immune system to attack its own tissues, 4 is an infection or medication or another exposure in your environment that triggers the disease. The symptoms are caused by swelling and inflammation in the blood vessels that supply your skin and muscles and can include: 1 red or purple rash on sun exposed areas that may be painful or itchy, 2 red or purple swelling of the upper eyelids, also called as heliotrope, 3 red or purple spots on the knuckles, elbows, knees and toes, called Gotron's papules, 4 is the joints that feel stiff and turn pale and painful in cold conditions and feel better when warmed, called Raynaud's phenomenon, 5 scaly, rough, dry skin which can lead to hair thinning, 6 swollen red areas around the fingernails, 7 hard lumps under the skin caused by calcium deposits, called calcinosis, 8 muscle weakness in the neck, hip, back and shoulders, 9 trouble swallowing and voice changes, 10 tiredness, fever and weight loss, 11 muscle aches, 12 trouble rising from a chair or getting out of bed due to muscle weakness. Sometimes the muscle weakness also spreads to the heart, GI tract and lungs. This can cause breathing trouble and coughing. Adults may have a low-grade fever along with lung inflammation and sensitivity to light. The process starts with a person's medical history and a physical exam. The doctor will look for an underlying disease such as cancer. Tests may be done such as: 1 blood test. These are done to look for signs of muscle inflammation. They also check for abnormal proteins that form in autoimmune disease. The most common blood tests include muscle enzymes, creatine kinase and anti-nuclear antibody. 2 electromyogram, also known as EMG. This may be done to find abnormal electrical activity in the affected muscles. 3 MRI. This test uses large magnets and a computer to look for inflammation in the body. 4 skin or muscle biopsy. Tiny pieces of tissues are taken to be checked with a microscope. Treatment will depend on your symptoms, your age, and your general health. There is no cure for the condition, but the symptoms may be managed. You may need more than one kind of treatment, and your treatment may need to be changed over time. Treatments include 1. Physical therapy, special exercises to help stretch and strengthen the muscles. Orthotics or assistive devices may be used. 2. Skin treatment. You may need to avoid sun exposure and wear sunscreen to help prevent skin rashes. Your doctor can help treat itchy skin rashes with antihistamine drugs or with anti-inflammatory steroid creams that are applied to the skin. 3. Anti-inflammatory medications. These are steroid drugs or corticosteroids. They ease inflammation in the body. They may be given by mouth or through an IV. 4. Immunosuppressive drugs. These are drugs that block or slow down your body's immune system. 5. Immunoglobulin. If you have not responded to other treatments, these drugs may be given. They are donated blood products that may boost your body's immune system. They are put directly into your bloodstream through an IV. 6 is surgery. Surgery may be done to remove the calcium deposits under the skin if they become painful or infected. Talk to your doctor about the risks, benefits, and possible side effects of all the medications. Now, let's learn about dermatomyositis in children. Childhood dermatomyositis describes a group of muscle diseases characterized by chronic muscle inflammation followed by progressive muscle weakness. 1. Skin rash, that is patchy and bluish purple or red, that precedes or accompanies muscle weakness. 2. Swelling in the affected area. 3. Calcium deposits. Careful clinical evaluation is required to determine the cause of the symptoms. There is no cure for dermatomyositis, but you can treat the symptoms with medication, physical therapy, exercise, heat therapy, and rest. Medications include corticosteroids, immunosuppressant drugs, and topical ointments. Possible complications for some people with dermatomyositis include lung disease, heart disease, or cancer. These can make the treatments more difficult. If you have dermatomyositis, you may need to be treated for the rest of your life. It is important to learn as much as you can about the disease. Work closely with your healthcare provider. Researchers are studying causes and treatments for the condition. Early diagnosis and treatment for the disease may improve over time. If your symptoms get worse or you notice new symptoms, notify your doctor. Now coming to the key points. 1. Dermatomyositis is a rare disease that causes muscle weakness and skin rash. Symptoms include red or purple rash on sun-exposed skin and eyelids, calcium deposits under the skin, muscle weakness, and trouble talking or swallowing. There is no cure, but treatment is done to reduce the symptoms. Complications include lung disease, heart disease, and cancer. So that's it for this video. I hope it was informative. Thanks for watching. Stay healthy and stay happy until my next video. Bye bye.